Hello and welcome to this edition of KSB Wellness. To all the fellas out there, November is Men's Health Month, and so is June. They had to come up with 2 months because we are so good as men at neglecting our health. So, I see patients in the clinic, and so many men say, my wife made me come in. My girlfriend told me to go see the doctor. My parents want me to see the doctor. My siblings said I need to get checked out. If we're not going to do it for ourselves, at least we should try to do it for all these people that love us and care about us. It seems like they want us to be around for a while. So maybe that's the reason that we need to take care of our health. Still, the number one killer of men and women in the US is heart disease. And the ways that we can prevent that are with cardiovascular exercise, not drinking to excess, and not smoking. And it's not just smoking that's bad. Chewing tobacco, the Zins, vape, anything that is going to have nicotine in it is going to diminish your health. The problem with nicotine is that it's a vasoconstrictor, and that raises blood pressure and constricts blood vessels. So if you think about it, nicotine is also very bad for erections. You need good blood flow for erections, and nicotine can really lead to erectile dysfunction. So no nicotine is healthy. On the alcohol side of things, the recommendation is no more than 2 alcoholic drinks per day for men. And I wouldn't even have 2 beers every single day. It's better to give your body a break from that. And once in a while, for a special occasion, if you want to have a little more than 2, that's probably okay. But you don't want anything to become a habit and a daily routine with alcohol, because not only can it hurt your liver, we all know about that, it can also damage the kidneys and the heart and the brain. Alcohol gets in the bloodstream, obviously, that's the blood alcohol level, and it's toxic to all of these organs. So we really have to watch that, guys. Some people think, oh, it's not that big of a deal. I just have a few beers every day. And that'll take its toll on you. So that's something to think about. The other thing is screening tests. We're really looking for cancer most of the time. And for men, if you've smoked or are currently smoking, you want to talk to your provider about lung cancer screening with a low dose CT scan. That can find these nodules and very early cancers before it becomes deadly. The other screening to consider for cancer is colorectal cancer screening. We always used to start at age 50, but we started to see a lot of young men getting colorectal cancer. So now the recommendation is at age 45, unless you have a strong family history earlier than that. A nice thing is, you've probably heard of Cologuard, comes in the blue buckets or boxes, and you can do that once every 3 years. If it's negative, you basically poop in a bucket and mail it off, and they look for abnormal DNA in those colon cells. And if that's positive, then you would need the colonoscopy. Prostate cancer is another one that we can screen for with the PSA blood test. It stands for prostate specific antigen. And this can tell us, it can be high for a couple different reasons. So just because it's high doesn't mean you have prostate cancer, but if it's high, you're probably going to need some more evaluation, and you may end up seeing a urologist for that. There are risks and benefits to screening. There are some false positives. So sometimes you'll have an elevated PSA and get very worried about it, of course, and it may lead to biopsies, which could have side effects, all for nothing. because many men in their later life, 80s and 90s, have prostate cancer that they've probably had for years, and it hasn't caused them any problems. So talk to your providers about this. We call it shared decision making. Discuss the risks and benefits and decide if the blood test is right for you. The other thing we routinely screen for is high blood pressure and cholesterol levels. So these are things you want to manage to prevent that heart disease. They do say heart health is brain health. So if you keep a healthy cardiovascular system, you're much less likely to develop dementia. We all work hard, whether you're sitting in a combine all day or a truck, or you've got a desk job, or you're working in a factory, you come home exhausted. But that doesn't mean that you got good cardiovascular exercise over that day. So really, you've got to budget in 30 to 45 minutes of good cardiovascular exercise. That could be jogging, it could be walking at a brisk pace, it could be swimming, could be exercise bike. Doing that 3 to 5 times per week is what it takes to really stay healthy. That'll keep your weight down, keep your blood pressure down, help you avoid diabetes, etc. So try to budget in that time. And the final thing is mental health. Men are so often, stereotypical tough guys and don't address their mental health. And that leads to problems. I think counselors are very helpful. And if you tried one counselor and it didn't go well, you may have to try another one. But to open up and talk about our anxieties and our depression and anger issues, it's going to make us feel better. It's going to make us perform better at work and school and be a better family member to those that we care about. So it's getting to be harvest season right now in full swing. It's football season. It's deer season. We want to be out enjoying these activities, and we want to be able to enjoy these activities for years to come. So that's the importance of taking care of our health. Thanks for listening. And if you have any questions, really reach out to a KSB family physician or internist or nurse practitioner and get established for some primary care. We can help guide you through these health challenges to keep you going. So thanks a lot.